Hi, Dr. John Torres here on my Facebook Live, where every week I go over headlines concerning coronavirus, concerning other health topics, and give you information in those headlines, particularly information behind those headlines that I think can help you, your family, your loved ones, your community get through this pandemic sooner rather than later and as healthy as possible. And today we're going to talk about the coronavirus, the pandemic, and this new variant that's out there. And we're also going to talk about a different story that has nothing to do with the pandemic, but I thought was fairly interesting. But first off, let's talk about this variant, Omicron. It's the new variant that was first reported out of South Africa. Now, we don't know exactly where this variant started because now we're hearing that it might have started in other countries and then ended up in South Africa as well. But the way we, as the world, heard about it is South Africa reported some cases that had a strange constellation of symptoms. Those cases were reported to the World Health Organization, which last week sent out the message saying, hey, we are seeing this new variant out there, and this is a variant of concern. This is a variant that we're more concerned about than some of the other ones that are out there for a variety of reasons, which we'll talk about in just a minute. But first off was the naming part of this, because it had its regular number name. It's very hard to understand and hard to remember. So they decided to give it the Greek alphabet name they normally do. They skipped a couple of letters, one of them being nu, because they felt that would be confused with any kind of new variant that might come out there. They decided to go to Omicron, or Omicron, depending on how you want to pronounce it. I'm pronouncing it Omicron now. It is basically one of these variants that's out there that is causing some concern, not just with the World Health Organization, but with experts around the world. And the reason is because of the mutations that are associated with this variant. Now, the spike protein, which, as you know, is the part of the virus itself that lets it attach to the cell wall. When it attaches to the cell wall, the virus can get inside the cell, and then it can replicate, it can duplicate itself, get outside the cell, and infect more cells, get outside the body, and infect more people. And so this spike protein is where we look for these mutations. And in this case, it had a constellation of around 30 mutations. Some of those are very concerning mutations because they're possible that those mutations could make it more infectious, more contagious. And that was a big concern. But it ends up being that there's a lot of things we don't know about this. And again, going back to South Africa, where it was first reported, they noticed in some of their patients they were having different symptoms than they typically had if they had COVID. Now, typically with COVID, people think about symptoms that they have where they end up having loss of sense of taste or smell, and they end up having a cough because it's a respiratory type virus. Well, in this case, they didn't lose their sense of smell or taste. They weren't coughing, but they were complaining of a few other things: headaches, body aches, and fatigue were the main ones they were complaining about. Plus, they tended to be younger people who were getting this as well. South Africa does have a very low vaccination rate. Last I saw was around 25% fully vaccinated. And so this has the opportunity to move in and they can observe what's happening there. So once this was set out, the message was sent out, other countries started looking into it. And right as of now, over 20 countries have identified Omicron in their countries. And so it is spreading around the world. To some extent, it's almost like the barn doors are being closed after the horses have gotten out, and the virus is already out there getting in other areas and will possibly spread. As a matter of fact, yesterday, President Biden even said that we're going to do some actions here, and those actions are not going to stop the virus, this variant, from spreading. They're just going to slow it down, which will give us both more time to understand it and time to make sure that we get things in place, like get more people vaccinated, get more people booster shots, and understand what else we need out there to keep people as protected as possible. And so that's where we are, fully understanding that these are not going to cause the virus to go away, these travel restrictions that have been put in place, or this variant to go away, but instead what they're going to do is they're going to hopefully slow it down a little bit. And that's what we found from other travel restrictions. They didn't slow the vaccine down, or the virus down. They didn't slow the variants down, or they didn't stop the variant, but they ended up just causing it to slow down a little bit before it got to other parts of the world. And so that's what they're hoping for here. Now, as far as what we know about this, we know, again, that it appears to be more contagious, and we know that it seems to have all these mutations on the spike protein that could cause issues with certain things. But what we don't know are what those issues would be. Do we think that the vaccines are going to be less effective? Possibly. And most experts are saying they think it will. They just don't know how much. Is it going to drop from 93% to 90% to 70%? what most experts are saying is it's not going to drop from 93% effective after getting a booster down to 0%. It's still going to protect us to some extent. We just don't know how much. And speculations are it might drop a little bit. It might drop more than a little bit. We don't know at this point. Will we need booster shots? Again, possibly, but time will tell. We'll know more over the next couple weeks, and I'll certainly keep you informed as well. And how much more contagious is it? It appears like it's more contagious. Is it more contagious than the Delta variant, though? That is the big question right now. And it's possible that it could be because of all these mutations that are out there. And then how do the vaccines and the drugs we have work against this variant? Again, with the vaccines, we don't know. With the drugs, there's some indication that it may lose some of its, those drugs might lose some of their effectiveness as well. But again, this is all very early in the process. It's been less than a week since we've known about this. It'll probably take another couple weeks before they can replicate the gene sequence here in the virus, build up the virus to test it and find out what that means. And so as time goes on, we'll learn more and more and get more and more information. So hopefully that we find out more as time goes on. But in the meanwhile, what can you do? Well, the best things you can do right now, and by far the best protection you can have, is to be vaccinated. And if you're outside of 6 months of that last vaccine, get your booster shot. Right now, they have just said, the CDC changed its recommendation. And instead of saying that you may get a booster shot, 18 and above, if you're not in a high-risk field or if you're not in an area where you have problems with lots of cases, or if you're above 65, they're now saying that everybody 18 and above should get a shot, should get the vaccine. And so again, it's extremely important that you do that, get these booster shots. On top of that, masking can help, washing your hands, social distancing, all those things we know that work are important. But let's look at the numbers in the world and see what's happening. So in the world right now, and this is before this Omicron variant is out there and is extensive, we are seeing cases rise around the world, and in some places they're rising fast, other places are rising a little bit. In some places, like the U.S., they're tending to come down a little bit, but with a word of warning, that doesn't mean they're going to go right back up. And if you look here at the different cases around the world, right now, of the countries I look at, and this is per million people in that country, the Netherlands has a little over 1,200 cases per million people. Put in perspective, the U.S. is at 235. Japan is at 0.75, so less than 1. And those are probably the biggest areas of difference between all those countries. Europe is having some issues right now, and they have high numbers going up. Their rate numbers are going up. Here in the U.S., absolutely. You're not doing it by population, but across the country, we're around 75,000 cases, which is a drop from the 95,000 we had last time we were on here. But is it going to trend down? We don't know. And because of holiday travel and get-togethers, there's a concern it's going to go up. With the Omicron variant, there's a concern that could go up even higher. So again, we need to take care. We need to watch ourselves. We need to make sure we get vaccinated. We wear masks. We social distance. We ventilate when we can and do all those things, those appropriate things. And so that's the coronavirus news for the day. Let me talk about one more story I have out there, just because I thought it was a very interesting story. And it has to do with reading to your children. Now, they did a study and they looked at children, around 70, a little over 70 parents who were reading to 2 to 3-year-olds. And they read them two different ways. One were these electronic books. So they read off the electronic books, where essentially what you do, as you know, if you've had an electronic book, you basically take it and you just scroll through the book. Just scroll. And if you notice here, I'm reading Dune, one of my favorite books. Well, what they found out is if parents, instead of electronic books, if they were using regular page books and they were going through the pages with their kids, sitting them in their laps before they went to bed at night, if they're going through the pages, they ended up paying more attention to their child, talking more to their child, and they ended up having their child interact with them more. Why is this happening? Well, they think the reason this is happening is because when you use an ebook, you have a lot of animations. And those animations can be active animations that attract the child's attention. So the child's not paying as much to the parent, paying as much attention to the parent and what the parent has to say. And so it's important that that interaction go on there. So what are the recommendations? Well, the recommendations are essentially to have these manufacturers of the ebooks pull down on those animations a little bit, not make them as vivid animations so it doesn't attract the child's attention, so parent and child can have that interaction. In the meanwhile, while they're getting to that stage, and hopefully they do take these recommendations, in the meanwhile, they end up going back, you go back to regular paged book. One of those things that we always did when we were children. Sit your child in your lap, sit down next to them in the bed, lay down next to them, and just read out of the book and interact with your child like we've done for generations and generations. And that's one of the best things you can do with them, especially now. They might get concerned about things like the Omicron variant or other news they're hearing about the pandemic. And that just helps give them that sense of security, that sense of well-being, and that connection with the parent, which as a parent, I can tell you, is one of the most important things in your life. And so you want to make sure that you have that down. So again, a regular book, hold in your hand, physical, change pages. Child can change the page. They can point at different things. That seems to work better than the ebooks for children as far as parents paying attention to the child and the child interacting with the parent. So again, food for thought and things to think about. So here we went over a variety of things. One, the Omicron variant that's out there, and the news sounds very scary, but mainly we don't really know where we are or what is happening with this variant, how we don't know how contagious it is, we don't know how dangerous it is, we don't know if it's going to get around our vaccines or our treatments. At this point, we think it might to a certain extent, but it doesn't look like we have a firm understanding. We will over the next week or two. Number two, we talked about the numbers, how they are popping up around the world. Cases are going up. Here in the U.S., they're going down a little bit, but we need to make sure they don't go back up, especially after holiday travels. And then reading to your children. Go ahead and read to your children. Pick up a regular book. It's one of the most important things you can do. But otherwise, beyond that, I hope the rest of the week you have a fantastic week. Come back at the end of the week and we'll talk about where we are with this variant, any news updates we have, and go from there. So thank you, and I hope you have a wonderful rest of your week.